Love Boise State Public Radio podcasts? They are free to enjoy, but not free to produce. If you can give, your support helps keep shows like Idaho Matters and Scandalize available to everyone. Donate now at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Gemma Gaudette, and this is Idaho Matters. In 2018, Idaho voters gave the green light to Medicaid expansion, giving health insurance to folks who can't get traditional Medicaid or a subsidy through Idaho's healthcare exchange. And advocates say the program is saving the state money. The Idaho Department of Health and Welfare says Idaho Hospital saved $42 million in charity care in the first few years. But some lawmakers say the program will cost the state close to $100 million this year and want to repeal the program. Close to 90,000 Idahoans are on the program now and could lose coverage if the bill before the House Health and Welfare Committee passes. And supporters of expansion are hoping to convince lawmakers to kill the bill. Joining us now are Randy Johnson, the Government Relations Director for the American Cancer Society Cancer Action Network, and Hillary Hagan, Senior Policy Associate for Idaho Voices for Children. How are you both doing today? Welcome to the show.
Thank you, Samantha. It's a pleasure to be here, and thank you for covering this really important issue for us.
Yes, thank you so much for having us today.
So on Friday, we learned of a bill to repeal Medicaid expansion in Idaho. Came to the legislature. Can you talk about the bill, what it would do, and what it would mean?
Absolutely, Samantha. You know, the bill is a flat-out repeal bill of the will of the people for a Medicaid expansion, a lifeline that gives folks coverage to much-needed care, and it's a tactic that we're seeing being employed for years now. The legislature not really wanting to follow the will of the people.
Well, yes, and to add to that, I think that one of the things that's really important to note about the repeal bill that was introduced on Friday is if it were to pass, 85,000 Idahoans are going to find themselves uninsured.
That's a big number. And I want to come back to the number. But Randy, you mentioned that this passed by voters. And it may come as a surprise, the move on Friday, because expansion was approved by voters. And many people may not know that lawmakers can overturn that.
Absolutely. And that's one thing that we really want to be able to hit on is when voters went to the polls in 2018, they knew they wanted to take care of fellow Idahoans. You know, we're a rural state and we take care of our community. We take care of one another. And this is a way when folks found out that there is a whole group of individuals who need coverage, who are doing the right things and need that coverage. They came together and said, yes, we want to do that. And we just want to be able to see that go forward because we know when people get access to care, as you mentioned at the top of the show, that, you know, this is saving our rural hospitals, it's saving counties, and really it's saving hardworking Idahoans who are wanting to get that care for themselves and for their family. And to just go forward and just say, you know, we don't like this. We're going to repeal this bill. It goes against what a majority of Idaho voters wanted then. And I know Hillary can speak a little more to this, but it's even more popular than it was when it passed.
And Hillary, what kind of support does expansion have right now among Idahoans?
Yeah, so we've actually done some different polling of Idaho voters in the past year, and there have been several polls done across the country that show Medicaid is actually a really popular program. And when you look to Idaho voters specifically, even among Republican voters, there is significant support for Medicaid and Medicaid expansion. While expansion passed with 61% of the vote, support has grown to 73% of Idaho voters support keeping Medicaid expansion as it is today.
So how do you counter arguments that we're hearing from lawmakers, and we heard this about a repeal, that a repeal would save the state something like $100 million a year? What do you say when you hear that?
So I can speak to that a little bit. I know that That was one of the comments from the chairman who had introduced the bill on Friday, that it would save the state money. But the fact is, the state would lose money. Idaho has a really tremendous match rate from the federal government to cover Medicaid expansion. Idaho only pays 10% of the cost. And this saves the state money because without Medicaid expansion, we were paying for services like behavioral health care services that were previously covered at 100% of local and state tax dollars. Not to mention, we have about $1 billion of funds coming into the state from the federal government that goes directly into our healthcare economy. And so if we move forward with repealing Medicaid expansion, we're going to lose that $1 billion coming into our state, into our communities, and into our economy, but we also lose that federal match rate. And we're going to lose all of the savings that we're seeing in other programs that we were previously covering at 100% of the cost.
So let's get back to that human cost. And Hillary, you mentioned that 85,000 people could get knocked off the program if it's repealed. What are you hearing from folks who are on Medicaid expansion right now? What are they saying?
So I think that's a really great point. We have a gentleman that we've worked with quite a bit on how Medicaid expansion has helped him access healthcare that he would have not had otherwise. He has had several health conditions over the last couple of years, and he is terrified of what it might mean if he were to lose his health insurance access. He had ended up in the emergency room a few months ago and wouldn't have been able to cover those costs if he had not had Medicaid expansion. And he even says, I wouldn't be here today if I didn't have that. And so he's really scared that if something like that happens again, he won't be able to go to the doctor. He's going to delay care, and it could cost him his life.
Randy, go ahead, Randy.
Oh, I was just going to add on to that as well. I mean, I represent the American Cancer Society Cancer Action Network. And so, I really represent the thousands of Idahoans who are living with cancer, who will be diagnosed in the future, and those loved ones who walk alongside them through one of the toughest journey of their lives. In fact, I mean, we know that about 11,820 people in Idaho will hear those life-changing words, "You have cancer," for the first time. And for those individuals, they're scared because Medicaid expansion is more than just a policy, it's a lifeline. It's giving access to people to have timely diagnoses, life-saving treatment, and the chance to fight back against the disease. So without having access to care, these individuals are looking at a cruel reality. Do they pay for their care, or do they face financial devastation? And folks are scared about that because we don't know where cancer is going to pop up from. It doesn't know political ideology. Cancer doesn't care about socioeconomic status, your zip code. It can happen to anybody. And so when we start looking at just taking 85,000 Idahoans off of coverage and just saying, no, thank you, you're on your own, those folks are at real risk of cancer and many other disease states that are out there that they just have to make those decisions. So those financial costs get put directly back onto folks who are looking to seek care.
What are you telling folks that you're talking to who maybe want to make their voices heard? How do they do that? How do they talk to lawmakers or get involved if they're worried about a possible repeal of Medicaid expansion?
Yeah, I can speak to that a little bit. So the great thing about our Idaho legislature is our legislators are very invested in hearing from their constituents. We have a very accessible legislature compared to other states. And I always encourage people to look up who their legislator is. It's really easy to go to the legislative website, legislature.idaho.gov, and just type in your address and it'll pop up your legislators and who they are and their contact information. And we have a lot of new legislators this year who are at the Capitol for the first time, and they're eager to hear from people. They want to know the issues their constituents care about. And so we're highly encouraging everybody to reach out to their lawmaker, their legislator from their legislative district and say, this matters to me. Please support Medicaid expansion.
Randy, we've got about a minute left. Are you worried?
Absolutely, because the threat is real, right? Not only from actual straight out repeal of Medicaid expansion, but we also know threats are out there they're looking to seek to add layers of bureaucracy and red tape to expansion. And so, yeah, I mean, I'm scared. And the folks that I'm talking to, they're scared too, because again, in Idaho, we want to take care of one another. We're a rural state. We're connected to our neighbors. We want to ensure that if folks need to have the care that they need, they have access to it. And this bureaucracy, this red tape, and really going against the will of the people, it's something that we are fighting really hard to stop and educate our lawmakers that the program is working as intended.
We've been speaking with Randy Johnson, the Government Relations Director for the American Cancer Society Cancer Action Network, and Hillary Hagan, Senior Policy Associate for Idaho Voices for Children, about a bill in the Idaho legislature that would repeal Medicaid expansion in the Gem State. I want to thank you both for being here today.
Thanks for having us.
Thank you for covering this. Again, it's a really important issue, and having that voice out there is what's going to help us protect this important program.
I'm Gemma Gaudette, and this is Idaho Matters.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.